Hello, my name is Jill Lindeman, and I would like to welcome you to the presentation of preventing bacterial pneumonia through the use of an incentives barometer in post-surgical patients. What is bacterial pneumonia? Bacterial pneumonia is an infection in the lungs that may cause inflammation, an increase in fluid or mucus production that may result in a difficulty to exchange oxygen. Bacterial pneumonia commonly presents with fever, shortness of breath, decreased oxygen intake, also known as hypoxia, a productive cough, and increased mucus or fluid buildup. Oftentimes, bacterial pneumonia can be diagnosed by chest x-ray, listening to a patient's lung sounds, or through a sputum culture. So the next question you may be wondering is, what is an incentives barometer? An incentives barometer is a device used to set a measurable goal for the patient to actively take deep breaths. An incentives barometer can be used to help keep air moving in and out of the lungs. The increased air movement reduces the opportunity for bacteria to grow by helping to clear secretions and fluids that may build up. So you may be wondering, why is this important to you? You may be interested to know that up to 7% of patients with normal preoperative lung function develop lung complications after a surgery, and 70% with pre-existing risk factors develop infection. Some of these risk factors include obstructive sleep apnea, asthma, chronic obstructive pulmonary disorder or COPD, and obesity. This is also important to you, and you are watching this presentation because it has been determined that you are at risk. You are at risk because you have already have or will likely receive surgery. This slideshow will teach you how to use an incentives barometer to reduce your risk of developing infection. Through using the incentives barometer, this will also help prevent bacterial pneumonia. So my learning objectives for you are that when this video is complete, you will be able to identify 2 risk factors for pneumonia, verbalize how the incentives barometer works on your lungs, and finally, you will be able to perform a return demonstration to verify that you understand how an incentives barometer is used. So what are some of the risk factors of pneumonia? Some of the risk factors are increased pain after surgery, particularly if you have had an abdominal surgery or surgery anywhere on your torso. Another risk factor is decreased mobility. You may have decreased mobility because of your increased pain. It may make it difficult for you to take deep breaths and help to clear secretions out of your lungs. Another risk factor is intubation during surgery. There is a risk that during the intubation, new bacteria may be presented into the lungs and your body may have a difficult time fighting off those bacteria. So now you may be wondering, well, how can I decrease my risk for pneumonia? One of the big factors in decreasing your risk is decreasing your pain. You may be able to decrease your pain through relaxation techniques or more usually through medications. The other way to decrease your risk for pneumonia is to increase your mobility. This must be done even if your pain isn't completely gone. Increased mobility will reduce the risk of further respiratory decline. And lastly, you must use an incentive spirometer. The incentive spirometer will increase air movement in your lungs, reducing the likelihood that bacteria will grow in the mucus or in the fluids that your lungs are secreting. Using the incentive spirometer may make you cough, but this is a good thing to help remove secretions out of your lungs and help get those bacteria out. So now you may be wondering, how do I use an incentive spirometer? It is important to note that you must take a break between each breath. This will help to prevent hyperventilation and any dizziness that may occur from taking breaths too rapidly in succession. The nurse, the physical therapist, or the respiratory therapist will help set a goal for your incentive spirometer. They will do this by observing you take 3 to 5 initial breaths using your incentive spirometer and using the average of those breaths to set a reasonable goal for you. To accurately use an incentive spirometer, the patient should exhale completely, place the incentive spirometer to your lips, draw in a slow, continuous breath. As you're drawing in the breath, watch the ball rise and attempt to reach the set goal. You should hold the inhaled breath for 3 to 5 seconds. Then exhale and repeat up to 10 times every waking hour. When a reasonable goal has been set, the healthcare provider that is educating you on how to use your incentive spirometer, whether it's the nurse, the respiratory therapist, or the physical therapist, will write your goal under Patient Incentive Spirometer Goal. The chart will look much like this one does. There will be a spot for you to fill in for each hour during the day, and at the bottom, it will be up to the patient to determine if they have met their goal or not. And you will see in this example, the patient goal was 800 milliliters for the day. At 8 o'clock, they only were able to take 775 milliliters of a deep breath, and by 11 o'clock, they were able to fulfill 850 milliliters. So at the bottom where it says, has the goal been met? The patient wrote in yes. So because that goal was met, the next goal that was written in was 250 milliliters more. And so you can see at 8 o'clock, 775 was again reached, and throughout the day, they did not meet their goal of 1,050 milliliters, so that goal would be carried on over to the next day. If they had reached their goal, they would again increase it to with another 250 milliliters, so it would be 1,300. So the key points that I want you to take home from this slideshow is that post-surgical patients are at an increased risk for pneumonia. You should also know that increasing lung expansion decreases risks for pneumonia. And using an incentive spirometer sets a measurable goal to increase lung expansion. Next, we will go over some questions to verify that you understand what bacterial pneumonia is and how to keep track of your progress. So the first question is, why are post-surgical patients at increased risk for pneumonia? Is it A, because of increased pain, B, because of decreased mobility, C, because decreased airflow in the lungs, D, intubation during surgery, or is it E, all of the above? And the answer is E, all of the above. The next question is, how does an incentive spirometer help reduce risk for pneumonia? Is it by A, increasing lung expansion, B, it sets a measurable goal to meet for the patient, is it C, helps to reduce bacterial buildup by increasing airflow in the lungs, or D, all of the above? And the answer for this one is D, all of the above. And the last question is, how can you keep track of your incentive spirometer use and if you have met your goals? Is it A, just try to remember what number you met each time? Is it B, write it down on the incentive spirometer spreadsheet each hour? Or is it C, the patient doesn't keep track, it is up to the nurse to know? And the answer is B, write it down on the incentive spirometer spreadsheet each hour. These are a list of my references. And lastly, does anybody have any questions? Thank you for your time.